Well, welcome everybody to Pivot Point of View podcast. I'm Destri Millsap along with Becky Pearson. For those of you just tuning in, I'm an athletic trainer and team roper, and Becky is a physical therapist and barrel racer, along with a horse physical therapist as well. And today we have a very, very special guest. I'm so excited. Dr. Kim Rasmussen with Red Bud Equine. Kim, how are you doing?
I'm good. How are you?
Good, good. So today we would love to learn more about you, where you came from, your background, and how you got into what you do now, and tell us about your business. So, Kim, I'm going to turn it over to you.
Okay. Kind of how it started. I guess, since I was a kid, I knew I wanted to be a vet. So anyway, we get you through all that. I did vet school, undergrad and vet school at Iowa State. And then I did an equine internship in California from 2004 to 2005. And I love that. And I love medicine and, dealing with all the internal stuff and neurology, all that stuff. And then I came to Oklahoma and took a job, and my personal horse. So I moved here all by myself, me, my horse, my Chihuahua, and my cat. So I rode quite a bit.
I love it.
Yeah, I was doing endurance rides on my thoroughbred, and I couldn't get muscle over his back, and his back would always be sore. And I took him to a chiropractor that did like kinesiology, and I was like, this is crazy. But I treated him for EPM. I'd injected his hocks. I had, treated him for stomach ulcers. I'd changed saddle pads, changed saddles, done a course of butte, given him, a month off. And finally, I x-rayed his back, before kissing spine was a thing even. And I actually ended up injecting his back, and I hated it when I did it because I knew I was just putting a Band-Aid on his problem, but I'd try to fix it in every way I knew how. So I injected his back between the spinous processes to help him with the pain. And then I went to a chiropractor about 45 minutes from here, and I thought it was crazy. And he did kinesiology with his wife, and took my horse home, and the next day his back wasn't sore, and the next day his back wasn't sore, and the third day his back was sore again. So I thought, well, he's fixable. I know he's fixable, but we're missing just a little something. And they had a vet from Quarter Horse World was coming the end of the year, a couple months from then. And so I called an acupuncture vet from Iowa State that I knew from vet school and said, hey, when you're down here at the World Show, will you come look at my horse? And he did, and he acupunctured him, the long needles and injections and everything. And it took about half his soreness away, and it lasted for about 2 weeks. So then my wheels are turning, because I love the heck out of this horse, and he would do anything for me. The most polite thing ever. But I knew it was fixable because the chiropractic helped him for 3 days, and the acupuncture helped him 50% for 2 weeks. And then I get a letter in the mail before our AAEP meeting at the end of the year, because we have, for vets, we have to have, so many continuing ed credits. So I'll go to the equine meetings, and a letter came out that said a human osteopath from Germany was coming to the whole horse clinic, and there's going to be a 1-day demo, just come down a day early. And I saw that, and he explained what he was doing, and how the nerves and muscles work together, and how the joints are being held and not mobilized. And I signed up for the course. So that's where it started.
Yes, and I love that you said, yeah, when I injected his back, I felt like I was just putting a Band-Aid on it. And so many times people get lost in an injection gonna fix everything, and really you're not finding the root cause of the problem. And that's where I really admire the way that you treat horses, is because it's the same approach that Becky and I take to people. Is we're looking for something other than Advil or cortisone injections and stuff, and trying to go to the root of the problem to get a lasting effect. So tell us about your mentorship and your philosophy in treating horses now, and kind of what you do.
As far as like mentorship now, so I kind of just went on with what I learned from those initial courses for about 6 or 7 years. And probably about that many years ago, I met a human osteopath here when she called me out to treat her daughter's high school rodeo horses. And she started videoing me. And so I started asking her some questions, found out she treats people at the VA. And she actually invited me to their study groups that they have once a month. And they had a human osteopath from Texas come up for a weekend course, and they allowed a measly little vet in, and it was eye-opening because I had learned mostly one of one type of direct technique, and I had gotten pretty good and comfortable, I would say, with that one. But leaving I was realizing how many other ways there are treat things, and you can get to a lot of deeper layers doing even, softer and indirect techniques. So we did a lot of that through those meetings that the human osteopaths here had once a month. And I met an osteopath here that started treating us, who was also interested in horses, and really helped me with my field. But as far as, philosophy for me, I would say, structure equals function. If the sacrum and pelvis aren't moving on all their axes, the horse can't stop, the horse can't turn. So we mobilize that, and the horse can do its job, and then suddenly you have these nice muscles coming on, and the horse actually looks prettier when it has a better posture and all the muscles can work correctly. And so as far as when I started doing this, I would, inject hocks or inject stifles, and it's so minimal now compared to what it was, because they can have arthritis and have zero pain if everything's moving right. And I think we can prevent a lot of that by keeping their bodies right, where they're not torquing on those joints incorrectly and causing that to happen.
I love that you did bring up joint injections, because I think there is a place for joint injections, whether it's in a horse or in a person. But I think what I see around here is the missing piece is that people just think a joint injection is all they need to do, and that they don't need to follow that up with either range of motion, stretching, things like that. So like if I get a person in the clinic and I'm having a hard time getting their shoulder pain under control or getting their shoulder to move better, they may need a joint injection to help us get over the hump, but we don't stop there. Then we get their full range of motion, and then we work on getting their strength. And that's one thing that I don't see happening a lot with most of the vets around here, is that, they don't necessarily have people go that next step of reestablishing the joint mechanics. And, also the point that you brought up about the adjustments or that chiropractic type stuff. I love chiropractic, and but I think, it's a little bit like the chiropractors get the joints moving, but how do we keep them moving in the right way? We have to establish that muscle balance to maintain that good joint mechanics. Is that kind of your philosophy on things as well?
Yeah, I agree. I definitely like that. And so it's been really fun to get to know Destri and talk to him, and even watch him work on people and me, and see that, it's, I think with the, the athletic training or the physical, type therapy that you do, or even me, if we acknowledge and treat the muscles and the fascia that's binding it up, instead of just doing, a thrust that could upset the tissue in the area and leaves the muscle memory there where things don't stay. Definitely, I think we need to reteach the body how to move and work correctly with stretches. I know, Destry has always got good advice for people on, okay, this was this way, you need to do this to strengthen, or think about this. And so when I get done with the horse, I'll go over with the owner, which, they saw what I worked on during the, treatment, but I want you to do this to stretch the SI, or want you to, lift here to stretch those muscles in the back. Like, do this before you saddle up. And I feel like the more we can educate the rider, the better they can take care of their horse.
100%.
And Kim,
My love the stretches. Yep.
yep. And Kim, for people that don't know you, you are not a big lady. Like, you're not like this big, tall, strong lady. Like, you're pretty petite and a shorter gal, and you're working on these big horses and getting things to move correctly. And I haven't seen anybody use some of the techniques you've used, which are very gentle and very subtle and still get great results. And so I really admire your technique there. And I had never seen somebody do the fetlock and the knee and things like that. Where did you develop that?
So like the I'll answer the fetlock and the knee one first. That I learned in my very first osteopathy course. And when I was learning that, I just about cried because I thought, man, I've had my hands on so many lame horses and done so many flexions on pre-purchases. And I didn't know those sesamoids were supposed to move because, in 2 seconds, I could have mobilized that for the horse and taken pressure off, his suspensory and his superficial flexor tendons. So that when he would, flex and extend, those pressures would come off. Or the accessory carpal at the back of the knee, it sits to the lateral side and it sits on the outside of the tendons where the deep and superficial muscles come down. So if the horse was to get kicked from the outside, it protects those tendons right there at the joint. But that should move out when they're weight bearing, and it'll soften and come in when they're not weight bearing. And the sesamoids at the back of the fetlock are going to do the same thing. So when it's weight bearing, those sesamoids are down and in, and that's what keeps the ankle from hitting the ground. But when they take weight off, it should come up and out and take pressure off that when it's not weight bearing. So I believe the study was done in Europe that if you leave a horse with those not mobile, or you have a constant tension on the tendon, they may not be lame, but they're set up for an injury. So I really feel like that prevents injury. And I learned that from my initial classes. And so on that one, I'll have the owner stretch and have the toe, held out straight forward. What causes it? They're on uneven ground all the time, turning, playing. I don't think we can prevent it, the nice balanced, farrier work for sure. But that's where I learned that. And I do think that prevents injury and keeps pressure off the tendon. So I think a lot of this is, us staying ahead of the game on injuries. Your other question on the soft techniques, the first day of the course, because the osteopathy course was not cheap and was not short. So the first day or the first session, I raised my hand to ask a question, and the instructor must have known what I was going to ask. And he said, I taught a woman who was 60 years old and 4'11" how to adjust horses, and she can adjust a draft horse with no tail. Do you still have a question for me? And I said, no, sir. Yeah. Yeah. And so he was great. And I really appreciate that he was coming to the United States and teaching. And then there's a man I was taking courses from here with some human physical therapists, and he was intrigued about the work on the horses and loved animals, but not a horse person. Well, how would you do this on the sacrum? I was like, no, I think you would get kicked if you did it that way. Well, how would you do this on the TMJ? I'm like, I'm pretty sure you'd make them rear up for that. And he came and watched me, and every time, I found something and went to make, the adjustment, he was like, try this or do this. And I was like, hey, tell me how. And what he explained to me was so you're talking about the soft techniques that look pretty subtle, that there's a pathway through every joint. And if you find the pathway where the joint wants to be freed up, there isn't much force that's needed. And he said the amount of feel you have will directly affect the amount of force that you have to use. So if you get real precise on, with the fascia, up, down, left or right, clockwise, counterclockwise, whatever, on all the different axes, and balance that tissue out, the body wants to be healed. So it really has made it fun.
Yes, and going back to what you said about the knee and fetlock, I mean, it's the same in people. If you are locked up in your ankle or locked up in your knee and you're putting pressure on other structure, or especially locked up in your hips, it's the same in horses and in people being locked up in your hips. You're putting a ton of pressure down through the rest of the chain. And a lot of things attached to those areas. So they have to be functioning correctly and moving correctly. And you can definitely prevent injury if those things are right. Some of the other techniques that I've seen you use, like the lymph stuff. Can you talk about that and how you work over the kidneys and livers and things
Oh,
like that?
yeah. So I took a lymph drainage course a little over a year ago. Bruno Chickley is the institute, and he's another osteopath from, somewhere over in Europe and has several courses. But lymph is something we don't really think about unless we're sick and we have, swollen lymph nodes or something. But the lymph, wants to carry, debris, bacteria, toxins out of our body, get it to the bloodstream where the blood can take it to the liver and kidneys and, be expelled. But so some of these horses that we've treated, for EPM or treated with antibiotics for, a respiratory infection. And then definitely on ones that have had their joints injected a lot with steroids. I'll be working over their liver, and there's a small lobe of it you can feel on the left side, but the majority of it we're able to palpate on the right. But when you go to drain the lymphatics on that liver, it's the body's big filter. It's the body's big filter and the body's big detox. And so, over time, they're really filtering a lot of things, even things that they would breathe in the air, the exhaust from vehicles, when you're stuck in traffic, and then, the trailer's right behind the truck and, they're getting, exhaust fumes and stuff from that. But the lymph drainage has been, really amazing. You want to free up the diaphragm first, because when the diaphragm's moving, inhale and exhale, that moves lymphatics through the thoracic duct, that gets it, into the heart and into the bloodstream. But the liver is one big, easy organ to treat, and you just treat it in both directions the way it's going to drain to that lymphatic duct, and that'll clear a lot of tension out, sometimes out of the rib cage. Even I've had checked ribs, mobilized the lymphatic fluids, and had their rib cage start to free up.
Yeah, and I think some people forget that, like with back pain, sometimes in the horses, especially back pain, they might have something going on with that kidney, or maybe vice versa. And so, or the liver. Can you tell people where the kidney and liver are on the horse?
Yeah. If you want to be like, if you're on the rib cage comes pretty far back, and you're going to be like maybe 4 inches from the last rib from the side of the pelvic bone there, and you can feel that. The liver is going to be mostly underneath that rib cage, right behind the diaphragm. So it's going to be right behind the lungs, and they'll kind of arc up in the center. The liver is going to sit towards the front and slightly to the right side. Kidneys are interesting. We actually call those retroperitoneal. So they're not loose in the abdomen with the liver and the stomach and the spleen and the intestines. They're outside of the peritoneum. They sit right under the low back, sit right alongside of the psoas muscle. So I'll know when I have a kidney issue when I'm checking that horse and I have restrictions at, say, thoracic. Horses have 18 ribs, so thoracic 17, 18, maybe L1, maybe thoracic 16, and they're in a segment. So if you have an internal issue, everything's innervated by the nerve roots off of each vertebrae. So if you have a segment of those there, I'm like, all right, was this a trauma, or do we have, some stagnation in the kidney, or have we been hit here, or is the psoas spasmed up and we've got some pressure on that kidney because of that? So you just blend down through the tissues and start to feel where the fascia is around those tissues. And, are we turned this way? Are we turned that way? Do we need, a little pressure here to release that, and things will start to mobilize. So I think between that and the psoas, it goes right along with the kidney, and that's going to be like your first 4 lumbar vertebrae. And yeah, there's some fun ways to help with that, and stretches owners can do after we get that freed up. But that's a muscle that can easily be torn, and so I think the psoas and the kidney are right there beside each other and can affect each other also.
Absolutely. And some people will treat soft tissue till they're blue in the face, but then may not know the visceral aspects that go along with some of those areas as well. And so um, you're not actually getting to the problem that is underlying there. So Kim, so you're the one that turned me on to the horse and rider eval stuff, and that we've started doing it, which has just been absolutely incredible. And so after you and I talked, I called Becky and picked her brain with her experience on like how can we come up with the eval program. And Kim, you and I had talked on evaling somebody riding their horse and watching the horse move, watching the person ride the horse, and then taking that information and storing it away, and then having them, and then doing a functional movement screen of the horse, watching the horse move without the rider, and then watching the rider off the horse perform specific movements, which is just incredible. And when I brought some horses to you for you to work on, and there was some people there, and you had me work on those people and work on you, and you're working on horses. That was just the dream life. I mean, that was just absolutely great. And that was a great day, and I hope there's many more days like that. And so tell me a little bit about what you look for with a horse under a rider, and what changes you might see with a horse without a rider when they move off.
I'd say like so. I started putting that a lot of that together, taking dressage lessons and going to clinics with trainers that are very. I would say the one I really learned it from, his website's called Ride From Within. He's a martial arts instructor, and he said if you want your horse to turn, he'll tip his sternum like half an inch to allow that horse to bend. And he sees things not like we do. He'll watch one trot stride, and we see one trot stride, one length of stride, or whatever frame the horse is in, and he sees 20 pictures. So it's been really amazing to listen to him talk, and how he's helped people all the way up into Grand Prix, which is what his sister did in dressage. And he says, if we don't have that flexion in our low back to absorb the spring of the trot, we're going to bounce. So if, I'm short, right? So I don't need to try to sit a trot on a 17-hand horse, because I don't have the mobility in my short back compared to theirs to make that motion. So, you never told somebody, you're on the wrong horse. You just do the best you can with what you have, and make it the best. But I was telling a human DO, she was here doing her residency just out of med school, and I was treating her jumper, and I said, I think when we have a physical issue, we put that on our horse. If our sacrum or ilium doesn't move, or we can't advance our hip on the right, that horse isn't advancing their right hip. And it took a while, but once we talked it's kind of like you and I are talking, like things mirror each other. So if we work on ourselves, the horse is allowed to do that. So there was a time where a girl was bringing her horses, and she brought them the second time, and all three horses had the same disorder in their pelvis. And I asked her if she was sore, if she ever got worked on, and she was like, no, I don't ever want anyone to touch me. So but some people do, and a lot of owners I've said that to are like, no, I'm sore here or there. And the dressage riders are really like precise on, it's hard for me to do this. And so it's coming together. And I think we really should do more evaluations to kind of open up this to the public, so they know that they can be helped and they can help their horse.
I agree. And so, I mean, it's no different than if you have somebody with poor throwing technique or poor running technique, and they keep having certain pains. I mean, whether there's a tightness or weakness there, if they just have a poor movement pattern, then they're always going to have those issues. And so at least getting another set of eyes and being like, look, if we just tweak this here a little bit, or if we strengthen this, or we mobilize this and allow us to be better for our horses, or just have better, smoother movement, then we're going to have more success in our event. And like we always say, everything's getting faster, everything's getting harder to win, and you're always looking for that competitive edge. And those are the little things that can make that difference in tenths of a second, hundredths of a second, in points on a horse judging score, all of those things. So I just think that's really cool that you introduced that to it.
The biggest thing that I've seen over the years is that people spend way more time and money on trying to fix their horse than they do on themselves. And so whether or not, they just don't know that they don't have to be in pain, or B, they put themselves last. A lot of the people I deal with are women, they're mothers, they're taking care of Lord knows how many things, and they put themselves last. So I think it's great we're having these conversations so that people realize they are 50% of that team, and they need to take care of themselves and not just assume that it's all the horse, or all the issues going on with whatever the musculoskeletal things that the horses have, that they have to take care of themselves too.
Absolutely. Kim, do you have anything else on that?
No, I think that was well said. I will run into the person that, blames everything on themselves. I'm like, look, no, we can help your horse too. But I think more is like what Becky was saying, that we'll do everything for our animals and forget to take care of ourselves, and forget, then we're a horse and rider, we're a team. And, I'm not going to ride your horse as well as you ride your horse. So, yeah, we all got to work together and put the time in.
Mm-hmm.
I agree. And you telling the story about your special horse, and we've all had that special horse. And so being our best for that horse, we owe it to them. I mean, they give us all they have, and we need to give them all that we have as well. So
Kim, where can somebody find you if they're wanting to get a hold of you?
Yeah, you call me. Destri's got my number. Yeah, I'm in the Oklahoma City area. Okay. So it works out for people from far away that don't have an osteopath in their area, because there's so many shows and competitions here. But yeah, otherwise I'm in the Oklahoma City area, and I travel a little bit locally. But yeah. And you're in North Dakota?
I'm in Nebraska.
Nebraska.
Yeah.
Okay.
Not quite so far north.
And Kim, people can search Red Bud Equine on the internet too, and get your number and things. Yeah. Also on social media, I think you have a Red Bud Equine as well.
Oh gosh, I have Facebook, and that's just under my name. I was gonna do a separate one, but it might be one more thing for me to keep up with. But
just right.
Yeah. Wonderful. Well, I am really you got my wheels turning on the osteopath side of things. I think that's wonderful. In the lymph drainage, I hadn't really thought about that on a horse. So I think that's wonderful to think of. Mm-hmm.
And you could take those courses too. Yeah, it was pretty fun. It was pretty fun. Little bits, like there's a service dog I saw, and I'd seen him before, but right after the lymph course, I was like, oh, I need to do lymph drainage like on his thighs and on his lower abdomen. And he just went flat out, like head on the table flat. And he's never acted like that. So, it was just a layer that he needed. And I didn't know that until I knew, right?
Yeah.
And so
one thing that we didn't talk about, are we still recording?
We are still recording. So you guys are going to make this hard on me to edit, but I might just let it roll.
Yeah. No, we can split it into two if we need to also. But you work on dogs as well. So somebody can come, get their horse worked on, get their dog worked on, and then
Have you there and fix them.
get
The
them work.
trifecta.
That's like a girl racer dream. Horse, dog, they'll I mean, that's a one-stop shop. Get your horse, your Aussie, or your wiener dog worked on, yourself worked on, your French bulldog, depending on what you
Right.
what your is. So
Or
you
your
bet.
doodle. I'm a doodle person.
Yeah, or you
It's really fun on the dogs to see, like, the show dogs stride out better, or the older dogs to get off their pain meds. Like, yeah, I squeezed a 1-year-old Great Dane in yesterday that was crying and not sleeping, and she texted me last night, that she was grabbing her toys and playing again, and it's just like you said, Becky, like, people don't know they don't need to live with pain, and neither do the dogs. Like, that's miserable.
Yeah. Yep.
yeah, that's so cool. I forgot that you worked on that.
Horses are my favorite, but the dogs are our buddies, so I love them too.
Yes. So
I'll have to look you up if I get down to Oklahoma. I'm just gonna have to come down there, I think, this summer for a bit.
We'll plan today. Destri and I work together. It is super fun. Super
Yeah.
fun. Has a great time, and we just always learning things, and it's fun to hear, the feedback. And it was amazing when Destri worked on me. I stood up and zero pain. Like, it's cool, and it was no whack and crack. It's just like, yeah, real deal. Yeah,
Magic hands.
absolutely. That's really great. So if nobody has anything else, Kim, thank you so much for being on here and joining us today. That was absolutely amazing. We really enjoyed having you. So we'll close it out. And thank you, everyone, for tuning in. And always make your health the pivot point to your success.